Knowing how to prescribe pain relief is absolutely key. So let's walk through a guide for doing it right and safely.
First, we'll look at pain assessment, then we'll hit each tier of drugs and finish up with safety. So, how do we actually measure pain? The first step is getting an objective sense of its intensity.
We use something called the Visual Analog Scale, or VAS. It's a simple 0 to 10 scale. That score tells us exactly where to start on the WHO's 3-step ladder for pain management.
Level 1, or poly-I, is for mild pain. We use non-opioids like paracetamol and NSAIDs.
Now, with any NSAID, you've got to know the risks, like potential kidney damage or issues in pregnancy.
Okay, let's break down the main NSAID families, starting with the classic salicylates.
Acid acetyl salicylic. You know it as aspirin, but watch out for patients with ulcers or asthma.
Next up, the propionic acid derivatives. You're going to see these ones a lot. This group includes heavy hitters like ibuprofen and naproxen. Again, peptic ulcers are a no-go.
And now, the acetic acid derivatives. This group packs a pretty strong anti-inflammatory punch.
Diclofenac carries a higher cardiovascular risk. With indomethacin, be careful with elderly patients.
So why the different side effects? It all comes down to their mechanism, selective versus non-selective.
This difference led to selective COX-2 inhibitors. The whole idea was fewer stomach problems.
But there's a trade-off. Celecoxib and etoricoxib aren't for patients with a cardiovascular history.
Okay, what if level I isn't enough? We move up to the opioids in levels 2 and 3.
Level 2 drugs like codeine are for moderate pain. For severe pain, we use level 3 agents like morphine.
But with more power comes way more responsibility and very strict legal rules.
Let's look at the legal framework. For example, check out the specific regulations in Algeria.
For oral morphine, the prescription is capped at just 28 days. That's it.
And for the injectable form, it's even tighter, only 7 days.
You have to use secure prescription forms, and narcotics need to be filled within 24 hours.
So this really gets at the core challenge. How do we balance potent pain relief with patient safety?